All right. Good morning. My name is Julie Wilcox. I am Director of Recruitment and Retention in the College of Education, Health, and Human Services. And we're here today to talk about our Health Education and Promotion major. And I will turn it over to Dr. Wagner, and she will tell you all about our program. Go ahead.
So thanks for having me. I'm the program coordinator for Health Education and Promotion, which is located in the School of Health Sciences in the College of Education, Health, and Human Services. In Health Education and Promotion, we have undergraduate programs, master's programs, and even doctoral programs in community health education and school health education. And then we also share a dual major program between health education and physical education, where students get both licenses to teach PE and health K-12. And unfortunately, I think we're all learning a really strong lesson right now about the importance of high quality health education and health education specialists. So essentially, you're seeing a lot in the community and the world with regard to what our folks with our degrees do. So some of us go to work in schools, some of us go to work in community organizations like nonprofits or other special interests. Organizations, American Heart, American Cancer, American Lung, Susan Komen. Some of our grads work for public health departments. They work in hospitals as health educators. They work in a range of work sites like universities, corporations, doing telehealth and health coaching, as well as high quality health education programming. Our competencies, the responsibilities of our profession were just recently tweaked. Our program is actually turning 50 years old here at Kent State University, so we're very proud of that. We're always reassessing our curriculum to make sure that we are preparing the highest quality of health education specialists. And our certification goes through NCHEC, which is the National Commission on Health Education Credentialing. And they recently expanded from 7 to 8 different competencies in which we assess the needs and the capacity of individual learners or communities or populations. We plan important programs. We implement those programs. We evaluate those programs and also conduct a variety of health-related and health education-related research. We do a lot of advocacy where we advocate on behalf of the profession, on behalf of health. Some of the work that we're doing right now, for example, is student groups are working on making masks and doing donations to some of our emergency responders and our first line folks, as well as advocating behind the scenes for positive health behavior change. We all made a big one in terms of self-isolation, at least here in Ohio, and are working towards other kinds of educational things, like how to wash our hands properly, how germ theory works, what we know about viruses, how to prevent them, how to help control the spread of them, so on and so forth. So I have been doing a lot more personal health education during this time as well. Communication would be one of those as well. So learning how to communicate with people, how to say what people need to hear, how to not just scare people, but to educate them, to try to encourage them with theoretical underpinnings to behave in ways that might be more conducive to their individual health or our population health. And then the last two are kind of new. They've been spread out. So we have leadership and management. So folks who might want to, like myself a little bit, go into a slightly administrative position or maybe manage a nonprofit of their own. And the last is ethics and professionalism. Given the sensitive content of what a lot of us do, it's very important that we adhere to our strict code of ethics and that we know how to behave professionally in any range of health-related issues. So our classes then are designed all around all of that content. And so students will take classes and methods in terms of how to actually teach. They'll take a variety of content, especially some of the more sensitive content. So teaching about alcohol, tobacco, and other drug use, for example, or some of the sexuality information. We also have minors in human sexuality, in community health, and then we have the drug abuse and misuse certificate. That's the class, actually, not the certificate. The certificate is so that folks can sit for the Ohio substance use certification exam, so they can also be a substance use prevention education counselor, essentially, the title of that would be. As I said, our program is 50 years old. We're really proud of the last all of that. But the last bit for sure, the last 3 or 4 years, every single one of our students has walked across the stage with a job already. So that's something that's exciting for us and that we celebrate. We also have a faculty scholarship that was left as an endowment by Dr. Cindy Simons that helps pay for, or completely pays for, health and HPE folks' Ohio licensure exams. And then on the community side, it actually also pays for our students to sit for the Certified Health Education Specialist exam. So depending on which major you're in, that's somewhere between a $400 and $800 gift left, as I said, by a former faculty member from our program. So lots of good things happening in health education and promotion. We're usually a major that students find later in life, and we're okay with that. Folks who want to do the kind of work that we do need to have that passion. And sometimes it takes a little bit of time for you to take some classes and sort of figure out what exactly it is that you want to be doing. And so generally we'll see you in one of our electives, the stress and management class, the human sexuality class, any of the drug use and misuse class or drug abuse and violence classes. And then folks are like, hey, wait a second, this is actually a job that I can do full time. And so we usually find you in your sophomore or junior years, which is plenty of time to still get you on a path to graduate with a pretty exceptional degree and one that you can find employment right out of the gate. And so, you know, if you have any questions, please let me know.
Thank you so much. So one of the things that you mentioned were that everyone has a job before they walk across the stage, which is nice. Can you talk briefly about a few of the students that you know, like where they actually are working or where they got that position?
Sure. So recently, a couple of our students, all of our students have a culminating experience at the end of their degree. So the school health and the HPE, the health and physical ed folks, have a student teaching assignment that they do at the end, which may or may not lead to employment by that school, but generally gives them that experience such that then they are easily hireable in a school. Our community folks, also, they have an internship at the end, a 400-hour internship. And so generally, in the last 2 years, I'm trying to think specifically, this is a good memory test, Jewel. Public health department in Seneca, New York, who ended up hiring her as the lead health educator at the end of that experience, which was really a cool experience. Most of our students do end up in more of that community setting. So we have a couple who are working in hospitals. Some of our master's students and PhD level graduates are actually working at nonprofit organizations and pretty big. We have an alumni who works for the military. And so, yeah, in that whole range of spaces.
Very nice. So you mentioned the internship. Talk to the students a little bit about how do they find that internship? What are the options for that internship? And, you know, what do they need to do?
Sure. So the internship is a little bit self-directed at the beginning. So in both the Intro to Health Education class and some of the other classes, you'll be introduced to faculty like myself. I teach the intro class, who will set up what the parameters are for that work experience. It is a big commitment. 400 hours is a lot of time. I had to do that myself as an undergrad. It was a very interesting thing to try to work full time for 10 weeks without getting paid. We are able to find some paid internships, but we have some local preceptors that we work with a lot, Akron Children's, Planned Parenthood. There's a whole range of lists. Generally, I try to meet with the students sometime in their sophomore or junior year, just to sort of get where their interests are going to be. In our field, we generally have content specialization and then space specialization. So someone might say, well, I prefer working with adults, or I prefer working with small children, or I really like physical activity and nutrition, or I prefer drug stuff, or I prefer sexuality stuff. And so I do just a little bit of a guided conversation with the students, suggesting, hey, why don't you reach out to this person, or why don't you reach out to that person, and then go from there. But a lot of the public health departments end up hiring our students. Like I said, some of the hospitals and generally the nonprofits are where most of our students find jobs.
Awesome. So you had talked a little bit about the certificates and the minors. And yes, I know that a lot of the students find us find this major, not right away. Freshmen aren't thinking the same. We have a few other majors, the same thing. It's that, that health and human services area. You don't know until you take that first class, how exciting it is and how much information and knowledge you have to share with others. So the certificate that you talked about, the Ohio, I'm looking at it, Ohio Department of Alcohol and Drug Addiction. So it's the alcohol, tobacco, and other drug certificate. What can they do once they get that certificate? So exactly what jobs are they applying for with that certificate?
So those are folks that might want to be educators in a rehabilitation facility. A lot of the inpatient centers will have an educational component, as well as the outpatient centers. Some of those folks will go on to be prevention specialists specifically. I had a student, just as an example, who was working in an agency in Columbus for her internship. She was very excited to go down there and work with an organization that centered around some sexual health prevention. She was doing some condom distribution work in some of the adult establishments in Columbus. And then it turned into, at some point, all of a sudden, she started using trans theoretical model, which is one of those ones that students are like, why do I have to learn this? And she was assessing readiness for change in a needle exchange program for folks who were injection drug users. And she just fell in love with it. And so now she does, again, some of that outreach, looking for folks who might need some access to resources, some help. She does some of the DAWN training that a lot of us have, the naloxone training
Nice.
to help someone who might be experiencing an overdose. But she works on that larger level for, again, one of our larger cities in our state, helping to prevent drug use and abuse, but then also capture some of those folks that might already be in some of those stages of use and suffering some of the consequences, to find and connect to resources that they might find valuable in terms of making some different life choices. So really, most of our degree options are multifaceted. So it's one of the reasons it's like, on one hand, we are kind of a catch-all of all of these different things. But on the other hand, it's kind of nice because our degree gives you both the practice skills and enough content knowledge that you can really turn it into whatever you want. There's just so many different ways in which a degree in health education and promotion or community health could go. So it's good work. There's
Yes,
always
it
a
is.
health crisis. So
Yes. Well, and I know that from talking to some of our other faculty members doing this recently, when we're making these videos and sharing information, is that our population is obviously aging. We are living longer, and that means different things. One is that we are active longer, so we need more health education for a longer amount of time. And we also need people to continue this work in that healthcare facility. And there are more people that are in healthcare facilities. So there's always jobs, which is nice. But I do like the fact that this major is so overarching that you can get anything that you want. You can make it into, like you said, you can work for a nonprofit, you can start your own nonprofit, you can work in a hospital, you can work in a nursing home setting, you can work in a school, you can pretty much work for a government, work for an agency. You said the military. I as soon as you said military, I thought of the guy who has been in charge of setting up the temporary spaces. I don't know if he's a general. I thought to myself that he's the head of the Army Corps of Engineers, and I thought, I wonder if he's got a degree in health. Probably a master's, probably in health education.
We're seeing a lot of our emergency response folks who do tend to be more likely to come out of like public health arenas. But even here at Kent, a lot of our public health students will choose to get the community health education minor, so that they still have that educational component. Because an Army, did you say general?
I think he was a general.
Okay, sorry. My brothers both served in the Army, but my expertise is not military titles. But anyways, they get a lot of that training about how to get people lined up and how to do certain things, right?
Yeah.
But a lot of our we've all been sort of fangirling over Dr. Amy Acton lately, because you can really see that when that person who's in charge, who's sort of helping guide us through things, is calm, is knowledgeable, is giving us a fair dose of, here's the reality of the situation, here's what we can expect, here's what we don't know. All of that is based on health behavior theory in terms of how do people need to hear the message, when do they need to hear it, how do we activate the appropriate responses in people. So yeah, that all comes straight out of old school health education and promotion. And like I said, at the beginning of this, even when our classes were still meeting face to face, my students and I in my human sexuality class were doing let's just do a refresher on how we wash our hands, and talking to them just about bacteria and viruses and germs and just how much of kind of a petri dish we live in all the time. As well as then how to protect ourselves from some of the nasties that can transpire. But You're right, with the changing demographic, nowadays I use an old school Ghostbusters reference, choose your destructor, right? Where essentially, obviously there are differences with social determinants of health that I never want to minimize, things like poverty and education, access to healthcare, things of that nature. But in the absence of that, chronic disease is what ages us and causes most of our death, and especially our premature death. And so, yeah, all of that can essentially be prevented and avoided, or at least postponed, right? One of the major goals of our Healthy People agenda nationally is to extend the years of healthy life. And so just to make sure that we all live that long, healthy part of our life for as long as possible, that last healthy part, I should say, for as long as possible. So yes, the work definitely never ends.
Yeah. Well, very good. I'm not seeing any questions, but we've talked about the internships. Oh, student organizations. That's always one thing. How can they connect with other students who are interested in the same kinds of things that they are?
Sure. So there's a whole range of student organizations on campus that are related to health and health education. I think we're up to over 200 different student organizations at Kent State right now. Nice. So not all of those are intimately connected to our program, but our honorary Eta Sigma Gamma is once a student has earned a certain GPA, usually it's at least a 3.0, up to they have to have taken a certain amount of credits, they can be inducted into our national honorary. Our honorary's 3 tenets are teaching, research, and service. And so we have a whole range of activity that takes place any given time. Unfortunately, they had a lot of in-person things planned. So they're the ones now they are sewing the face masks for our local community as well as emergency responders, and they're doing some online COVID education. But generally during the semester, they are raising money, they're doing programming. They had a big grant this semester for gambling prevention, gambling addiction prevention program, working with Town Hall 2, which is one of the local agencies in town that also tends to foster some of our community health interns. So
nice. Well, Thank you very much.
Sure thing.
All right. Well, thank you all for joining us. And if you didn't get to see us live, hopefully you're watching this. And we hope to see you in person sooner than later. So stay healthy, stay safe, and we look forward to meeting you soon. So thank you very much, Dr. Wagner.
Thanks, Julie.
Bye, everybody.